A lot of people are wondering how healthcare reform will affect them, and it will impact everybody in some ways. I think the way that it's going to be most helpful is that it will increase access to healthcare to a lot of Americans. The very first segment who will be impacted are people under the age of 26. Employers who offer health coverage to their employees and who provide dependent coverage will be required to allow employees to keep dependents on the health plan up to age 26. And that's even if they're married and not dependent upon them for support. Another increased access is that insurance companies will no longer be able to limit coverage to people who have pre-existing conditions. So that means people who are already experiencing health problems will still be able to get insurance, which is exactly what insurance is there for. If you're an employer and you offer health insurance to your employees, you may be eligible for a small business tax credit. You would have to have less than 50 employees, and there are income guidelines which may or may not apply to you. In 2014, when most of the provisions roll out, if you're an employer and you have 50 or more employees, you'll be required to offer health insurance to those employees. Whereas right now, employers are not required to offer health care to employees. If you are have over 50 employees and you don't offer health insurance and your employees have to use a voucher to get it through the state exchange, you'll be penalized $2,000 per employee per year. And so if you're an individual and you don't have access to employer-sponsored health coverage, you'll still be required to buy health insurance, and if you don't, there will be a penalty. And so I think overall, more people will be in the system, and the thought is that the more people that are insured, the more we're able to level the costs among the population. Because the fact of the matter is, we're paying for the uninsured's health care as it is anyway, because the costs for the uninsured are shifted onto the private pay people. So I think overall it will be a positive thing.